Hi everybody, I'm Dr. Akshith, ENT surgeon, MAA ENT hospital. So today we'll be talking about pediatric age group ENT related problems. Now why are they important is because we have the rainy monsoon season on our way. So the normal issues that we usually see in children are, one is recurrent throat infections. Recurrent throat infection means that the tonsillitis infection is active in the child. Now, when is it necessary for us to give more important care? When there's an infection, yes, the medicines are antibiotics. But if the child is suffering with more than 5 attacks in a year, we need to meet an ENT surgeon for a more valid opinion. That is on one side, and the other infection would be the chronic adenoitis. Now, what adenoid means is nose getting blocked because of the growth of adenoid tissue at the back of the nose. It's normally present, but if it grows in size, it's a problem. So, why adenoid is important is because some children have the habit of opening their mouth in their sleep and also having snoring issues. When snoring and mouth breathing are the complaints, we need to visit an ENT surgeon at the earliest, because the adenoid blocking the nose and the child suffering to take breaths during his sleep is not good for his overall growth. Coming to the hearing issues, some children at the age below 5 have a tendency to be active in their play, in their games, in their day-to-day activities. But some parents do not realize that the child is not able to hear some commands, some sounds. This needs urgent attention, because once the hearing problem is there, the speech as well gets affected. So, if there is any child whom the parents think is not speaking, they must visit an ENT surgeon immediately for the necessary evaluation. Nowadays, irrespective of the socio-economic status, educated or not educated, parents have found a much simpler way to keep the child engaged so that they can continue their activities. One such activity that as we ENT surgeons have noticed is giving their mobile phones to their children. Now what happens with mobile phone is the child is constantly attracted by the color of the graphics in the phone. Now this is not good for the child, because when we speak, we hear. When we hear, we speak. So if the child is not listening to words from his aunts, from his grandparents, from his parents, his speech can get delayed. This delay in speech has been noticed on a rising trend in the recent population, at least after the smartphone technology has come into the world. So this is another area where the parents need to be cautious not to engage the child with their mobile phones. If there's any issue that you notice in terms of hearing or in terms of recurrent throat pain, please drop a visit to MAA ENT Hospital, Jubilee Hills, Hyderabad. Thank you.